I'm sorry, one second, Teresa. Okay, so you see here that at the global level, WHO in 2011 report has very clearly said that equity, human diversity, and access is mandatory. And we have the UNCRPD Act of 2006, and for which India is a signatory. And it talks about full integration, treating everyone equally and with human diversity, acceptances of differences, and each difference has to be valued. So if I'm moving on a wheelchair, it does not mean that I cannot make a good architect. If I do not have my lower limbs, it does not mean that I can't become a good surgeon or an orator or whatever else. But somehow that's how it works. You cannot go out of your home. How many people with disability do we see on the roads? It's again the whole issue of the travel chain breaking. A part of the city is accessible, but there is a small little break somewhere in the travel chain, and therefore we are not. So, as we go forward, there are lots of pictures which have been picked up by uh, Parul Sharma, added by me further, and which is nothing new for you people. You because you're already experts in this area, but it is always nice to have a re-look at that. So we have the idea and the sustainable development, which has to accumulate in 2030. Not much time left. The 17 components of UN Sustainable Development Goals and seven targets are for disability directly, and six are for people who are vulnerable. Government of India, we've been working on, we have wonderful uh, accent policies. Implementation, sometimes, because often what happens is that multi interaction between different government agencies and the public, what is it, PP, are often not effectively done. And therefore, maybe this happens. So, when we are talking about the government of India, we have the Persons with Disability Act, which came in 1995. Then we signed the convention, the UN convention in 2008. And then we had the latest revised Persons with Disability Act in 2016. Of course, if you see the gap here, it is quite large. But anyway, this is how it happens. Now we are, and then we have other acts. We have the guideline, harmonized guidelines, which is for what are the different measurements, what are the different ways in which cities have to be designed, or any component of a city has to be designed, is very effectively being developed by the Ministry of Urban Affairs. And what is a disability? If a person is using a wheelchair, then the disability, this is an impairment, a component of which the person is. But because the social environment does not allow this person to be effective, to become a creative contributing member of society to the best of one's ability, is which increases the disability. And so, just because you're in a wheelchair, you cannot get employment. Transportation will be maybe a problem, so you're just not able to reach there. And there are other environmental factors: buses, staircase, the chair, the ergonomics, and so many other things which cause the person not to be able to reach one's potential completely. Again, disability is a evolving concept. As soon as our entire environment, attitude, social interactions change, the level of the concept of disability changes. So disability is the interaction between non-inclusive society and the individual. So coming to the next is, we were talking about the different accent policies. There's so much of it there. We have the United Nations Development of Economic and Social Affairs. We have United Cities and Local Government, which was the report came, the act was accumulated in 2000, in 2021. WHO 2015 spoke about inclusion and effective participation in social affairs, and then UN 2016 too. And let's have a quick glimpse into the issues, the concerns, and the doables. Again, with all of you knowledgeable experts on this particular platform. None of this thing comes as something which is unusual. It's right there in our cities. But have we been able to do a disability audit? Are we able to collect that large data? Until unless if we have that large data, how will data mining happen? And until unless we are able to focus on a component of our city as a showcase component, it will not spread to other parts. And the same applies from city to city and ultimately the country. So let's try to look at these glimpses here: vehicle, roads, routes and approaches, parking, reception, drinking water areas, toilet, marketplaces, and others. I'll go through this very quickly. Of course, we do see buses, low floor buses, low entry buses, some of them token. The concept of a dog guide or a space available in the bus for the dog guide, etc., is something which is still alien for us. I wonder why we have not been able to get a platform which moves in and out on our bus stands like this. I do understand maintenance and the public indifference or ability to spoil things is immense in our country. Of course, we do have buses like this, but I mean bus stands like this now. And if you look at the travel tiles here, the tactile tiles here, they have been effectively done here. This is from, I think, Pune. Many cities now in India also have it. Globally, of course. We are all aware of these very simple portable devices. But like in Russia, it's a social taxi system. In India, there were attempts to have Uber did try that, but I wonder if anything very effective has emerged out of this. But if you look at this, in this particular picture, the person can do this independently. But here, the person who is disabled is still dependent on the other. Same here, look at the indignity of this particular person moving from the wheelchair, then crawling through the pathway of the train inside the bogie, and then reaching there. Or this person very happy. Good, it's a probably one of the officer who's taking this photograph here. But if I had to do this, will I call myself independent? And how important it is to be independent rather than being dependent on others. Of course, India being a social collective where we work in groups, we have family units, we have neighbors, and we believe in keeping having people together. That's a very positive thing about South Asia. But one of the attitudes that emerges from there is we do not permit anyone to become independent. And if you're not independent, the person with disability or anyone else, then automatically it leads to limitations in the person's productivity at the to lead to being a creative, best creative citizen as possible. Others, if you look here again, dependency, but at least these portable things have started in our country. When we come here, I wonder if there is any tabletop crossing in any part of our country. And I keep thinking this is not so difficult to make or to maintain, but this raised yellow part I have not seen in any part of the country. And of course, this is how pathways have to be. But here comes in the, of course, the problem of our country when you're talking about पान वाली दुकानियां अगले दिन खुल जाएगी. I a large part of I am from the Delhi city of Delhi, and there's a lot of work, construction work happening presently there. But I still find that if there are these gold tactile tiles, they are being put in everywhere, and I'm so proud of my city and all the urban planners of my city. But the stop tile is mostly not there. Just now, I was sharing some pictures with Parul Sharma and in wanting him to try and support, help me to find people who I can tell. It's just one tile. But for that person with blindness, who is blind or very visually handicapped, 40% benchmark. Even I wear specs, but I do not come under the visual impairment. With my specs, it is corrected. But the visually impaired who are not completely blind, the best of spectacles, the best of technology does not give them that support. Now, this particular tile, which is just one, will, if it is not appropriately put, then what happens, that person is going to either hit his head against a tree or fall off the raised area from one part to the other part just because of the style. If you see here, black one, see, these are wonderful. It looks so beautiful. I'm sure from a urban planner's eye also, you may not be able to find many flaws here, but there is a particular flaw here which I see is the stop tile. The person is going straight, and there is an intersection. If you need to go down the stairs from here, there should be stop, watch, assess, then go. This is what the style says, but it's not there. In this particular picture, you have the stop tiles. Now, for a person who is using the white cane, the person is so confused. Am I supposed to keep stopping and looking, or can I walk straight? My children, my young adults with disabilities who went for a exchange program to UK, Edinburgh, suddenly said, it's so easy to move around. Everything you can believe what it says is correct. So all the signages are at the right place. We also attempt to do it, but there are so many mistakes that are there. This is perfect. This is good here. This is also right here. But at the same time, other issue here is, if you see, you want to go and drink water, you have these tiles, but it lands up hitting where the water is. Of course, we are improving, but what does the word dead mean? Marna. Let's see some pictures here. You go and hit your head. This is the tile and it's going here. Sure enough, you break your head. You fall down here. I wonder who was so wonderfully, this signage has been put in here. I want to ask the Delhi police, go to this place and I'd find out, how many people with blindness and visual impairment visit this particular chowki or knock at the window there. Okay, that's okay. But what about this? The person will go into the river, here, into the nala, break his head, her head, and this goes on. Same if you look at this parking. Here we have, right, if you notice, in the parking, the signage is so far away. It's not visible even to the most a person with 6 by 6 eyesight. Beautiful, wonderful. But I just wonder, was this ramp made according to the guidelines? If you see, this looks like more of this sliding thing. Play slide होती है ना बच्चों की, तो ऊपर चढ़ो उसमें से नीचे करो. And I remember uh, 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 Dr. Tuli, who was the Commissioner of Disability of India, and that point she used to say, when we used to find ramps like this, she would say, just help me, मैं भी इस रैंप के ऊपर चढ़ने की कोशिश करती हूँ. And both whoever was helping the person, her, would also slide down and she would slide down. And that was her way of showing that ये रैंप तो इसका तो 1/12 का रेशो ही नहीं है. 1/12 तो मिनिमम है, उससे ज़्यादा भी कर सकते हैं ना. ये रैंप इज बीन मेड परफेक्टली. But because of no awareness, no sensitization, somebody has beautified the place by keeping such a big flower pot here. Market spaces is another place that we could do a disability audit. Of course, we have a ramp here, but generally this is what it is, and the ramps often go like this. So that micro audit uh, audits need to be done, disability audits. I keep wondering, why don't we have more of these pictures everywhere? So it's like that school bulletin board. So whatever you were trying to teach the students, so those things are put on those in-depth corridors of schools and colleges where all that information is put there. If you put this in public spaces, there'll be other people who would be able to identify, except of course, the town planners, the architects, the schools of planning. They, everyone does know this. But there has to be some pressure groups also, so that if I'm from the school of planning, there's somebody to say, aisa bhi to ho sakta hai na. So the doctors are always scared of their patients because they go and do Google search, and therefore they have to be so much more vigilant. So can we for ourselves develop some awareness sensitization so that people come knocking at us and saying, ye to nahi hua hai. Of course, you're all aware of the latest harmonized guidelines and space standards for barrier free built environment for persons with disability and elderly 2016. And of course, we also have the 2021 guidelines revised version of that. And that has given the Ministry of Urban Affairs and the Ministry of Housing and Urban Affairs, Government of India, with all of you experts, obviously there had to be an expert team to do this, has done a very good job of this. So do visit this, and I'm sure somebody will. Parul Sharma always likes to put these links in the chat box. And of course, we have the Rights of Persons with Disability Act and Accessible India campaign. So when you're talking to the Accessible India campaign, we'll come to this later on. I want to bring to your notice again, I'm sure you already know this, and that is that look at this, we have 21 certified disabilities now, which our country certifies, recognizes, and RPWD Act to the bill. This is the bill. RPWD Act 2016 very clearly mentions that besides these 21 disabilities, others will be added gradually. Out of this, let's look. There are the sensory disabilities, which are the physical disabilities. So your physical disability, you don't have a limb, you can't walk properly, your hand shakes. I'm not giving you the technical terms for all this. And then you have the visual disabilities, you have the hearing disability. These are the sensory disabilities or the visible disabilities. We also have the neurodevelopmental disabilities like dyslexia, autism, etc. So when we are talking about green light, so we have the red, the minutes or the seconds go in red and the arrow is in green. For a person with neurodevelopmental disability, this causes confusion. So the latest I've seen on the roads is that green goes with green and the red stop sign goes with the red. Now, anyway, we will try and focus more on the physical disabilities here. And when I go here, this is, if I need to use the red part here, if I need to use this particular window, it is difficult for my wheelchair to come. So I will not be able to talk effectively put my questions effectively to the person, or whatever information I need or want to do, I will not be able to do it just because there is not adequate leg space here. This is so much better. There is a lift meant for people with physical disability, elderly, but you have to climb up the stairs. There is no path, tactile tiles here. The ones which the go tiles or the stop tiles here. But this is so much better for a person with visual impairment, or because this yellow is a very way it makes them, it's maybe jarring for somebody's eye, but so much better for them. And if you look at the signage, so effectively done. These rails, you can see it's difficult for a person with physical disability who needs a better grasp to be able to grasp these. We have so much technology at our beck and call now. These lifts are not only can be used not only for a wheelchair user, they can be used for so many things, and they're not so very expensive for an institution. Now these chair wheels are being put into many houses, also urban multi-story buildings as well. Why doesn't it? Of course, we had the process. If you look at this particular here, there's a chocolate here. We used to have chocolates earlier, but now this chocolate is going to be a problem for a person to enter. Such a minor thing. Maybe this is not a very good toilet. Inside, one can see the toilet may be very effective inside, but the chocolate is going to cause the issue here. Again, we're talking about water, washing hands becomes so difficult because the wheelchair can't go in. Drinking water, same here. Symbolic sign is not provided here. So there is so much more there is to this. And there are these so many resources which Paru Sharma has put together for all of you. And if you feel like going through them at one point of time. Would you like me to stop for a while? And if anyone has anything to say, would want to reflect something, add something?
Yeah, मैं भी यही कहने वाला था रेनू मैम.
Huh.
Thanks for saying. I would like to request if somebody would like to volunteer and share their experiences from Patiala कि ग्राउंड पे जब इस तरह के प्रोजेक्ट इम्प्लीमेंट करते हैं तो किसी को प्रॉब्लम फेस हुआ कि यूनिवर्सल
अच्छा.
डिजाइन फीचर्स को जैसे रैंप बनाने में या स्टाफ को समझाने में जो ग्राउंड पे काम करते हैं कॉन्ट्रैक्टर्स इंजीनियर्स तो उन्हें बताया तो जाता है बट वो जब इम्प्लीमेंट करने पे आते हैं तो भूल जाते हैं तो इस तरह के कोई या लैक ऑफ अवेयरनेस है स्टाफ में कि जो गाइडलाइन मैंने अभी चैट बॉक्स में शेयर की भारत सरकार की हार्मोनाइज गाइडलाइन है सीपीडब्ल्यूडी की 2016 की फिर अभी 2021 में रिवाइज करके नोटिफाई हुई तो इसके बारे में शायद क्या पता ही ना हो ग्राउंड लेवल पे जो स्टाफ है उन्हें तो ओवर
Arun,
टू यू. यस सर.
Arun,
जी.
Arun,
अजय. जी जी सुन रहे हैं.
yeah, Arun,
आई एम लिसनिंग.
I'm audible.
यस यस ऑडिबल.
Yeah, it's a very good topic to touch with, and I think you have fabulous data with you to present. But I was just wondering that such kind of harmonized guidelines been not been circulated among the government departments or been told to although we know the disability designs and other things to be accommodated in the design process, but I doubt that these all things are just been made on the paper. But when you go to the ground, because we are all practitioners, you know, so most of these things are considered to be the waste of the space. This is the practical shape which I am telling you on the ground. I don't say that these are all not needed. I think these should be the mandatory clauses to be put in the designs. But how I doubt that how many government departments are sincerely taking into the consideration into the designs or the urban designs or in the public buildings. I have come across so many public buildings which are being recently built. You're talking about, if I am correctly saying, that these guidelines were being done in 2008 and then 2016, and similarly it has been revised in 2021. For if I take on the flashback from 2008 to 2021, I think most of the government buildings might be acknowledging these guidelines, but how many are being done so correctly? That is what the ma'am is basically touching upon, and in the slides and other things, that whether these designs and standards are being taken very carefully while designing the architectural designs. That is the most
Totally.
important thing.
I
And the most important thing, that the contractors, I think there is a need for the contractors also to be educated, and the field staff, like you were actually been touching upon the right thing, that that they, the ma'am was showing the gradient of the this ramp,
Yeah.
which is to be done at least 1 is to 12 ratio. That is fine, but due to the due to the vested interest of the owners and the stakeholders, I think the people are not getting these things done on ground technically correct. So it is the responsibility of the first the government, definitely, as a society, as a human being, definitely we have owned that responsibility also. But it is the government, state government stakeholders, like urban planning departments, town and country planning departments, and all other PWD departments, whosoever is a part and parcel of the construction industry, needs to be taken these harmonized guidelines to their best level of to make it on the paper, and most importantly to make it on happen in on the ground. Because unless and until it is not been educated to the staff of the government departments first, and then siphon it to the local level or annual plans of the cities or to the ground level, because these all guidelines has to be sieved to the ground level. And that is only the thing that and I think uh, the most important thing, if I say to that, because it is not a part of our discussion, these things to be educated at the school level also. Because if we want your citizens to be responsible to accommodate those guidelines, I think at the school level also the students need to be educated. And that's what I have come across till now. Thank you
Yeah.
very
Thank you, Ajay ji, for sharing, your experiences and observations. And I fully agree to that. In fact, I would like to cite an example, जैसे CPWD, who
Yeah,
themselves, create these harmonized guidelines. So what happened when they constructed this building at 5 Janpat Road, Dr.
yeah,
Bhimrao International, Ambedkar International Center, which was inaugurated by Honorable Prime Minister. So there I witnessed, when I did the accessibility audit, they didn't follow their harmonized guidelines. So it is not disabled friendly. There is no tactile flooring
yeah,
and
yeah,
slippery
yeah,
surfaces are radiant. So they said that we forgot to, sensitize the contractors on ground and the engineers who were actually working on ground. So these problems happen, and some people are doing mistake in ignorance, because you are right that government has not properly conveyed the messaging at the ground level. Like the link I have shared in the chat for the harmonized guidelines, so you can refer these in future. But I think also in every state there is a state disability commissioner, superseded by chief disability commissioner at the center, and it is the duty of the state disability commissioner to ensure proper implementation of Rights for Persons with Disabilities Act 2016, and also keep the urban development agencies informed about what all provisions this act has, and which all provisions various urban local bodies and development authorities needs to adhere to. So what is
yeah,
happening at present, Ministry of Social Justice and Empowerment, they just write a letter to the chief secretary of various states, and they think that the information will be percolated down to the right department.
Yeah,
But still, we need to work on the ground level and sensitize staff. And I think this particular initiative which we are doing, this is a kind of dialogue which we have initiated to
yeah.
brainstorm together that what needs to be done, and why this is important, what is the need for having universal design. Because it's not only about persons with disabilities, but what about our grandparents, parents, our children, women with special conditions. So they all need universal design features, when accessing various buildings and other public places in the city.
And moreover, Parul, what I feel from today's
May
discussion
I
is,
please stop both of you? Could you please put on your video? So the tech team is asking for photos to be taken. So if
yeah,
Ajayji and Parulji, if you could just put your video on for 1 minute so the tech team can take a photograph
yeah, yeah.
Yeah,
and
yeah.
continue with the discussion. Sorry to interrupt.
And I sorry, Ajayji, you were saying something, and I will also invite other officials if they would like to volunteer and share their experiences, because they have
Yeah,
more knowledge of Patiala. Me sitting in Delhi.
Parul, I think even if you go to some uh, CHCs, health centers, or PHCs, primary health centers, community health centers, you will see lot of such problems coming across faced by. And I think the most important part which we are forgetting to touch upon, I think most of the cities in the country, like India, does not have any data of people with disability. Does
Yeah.
any city has a total data bank that what the type of disabilities ma'am were talking about are 21 certified disabilities? Does the cities have such kind of disability data till now? I doubt
No,
if any city
no,
does
sir,
have that full data bank.
you are very correctly articulating at the main point, and
which is
in the
where
coming
which
session
is which is where Parul, sorry to interrupt you, which is where the sensitization and the importance of this topic comes across. Once you have that
correct,
data, only then the design people will get be sensitized, because otherwise nobody
correct.
will feel like that doing
No,
such thing is just a
fully.
waste of space.
And in session 6, you will see we have session 5, sorry, we have highlighted the importance of disability specific disaggregated data. Because if there is data, only then we can plan properly. In the absence
Yeah.
of data, there is no point planning when you don't even know how big the challenge is. So we have in the coming session, we'll highlight that part. And may I request if there is any other comments or viewpoints someone would like to share from Patiala city, or what experience they face while working on ground.
I think
Could be
the person,
from any
person, one person, very senior architect of government department, chief architect office, Mr. Surinder Singh is somehow is not been able to join today, because he
okay.
would have been
No,
a.
architect
Surinder Singh is there. Okay, Surinder Singh is there.
yeah, yeah.
Okay,
And
fine,
architect
fine,
Rajneesh
fine.
Walia ji, Harpreet Singh ji.
Yeah, he
So
is there.
we
Okay,
would
fine.
like to
Sorry,
volunteer
I
there.
mentioned the wrong thing. But somehow, I think such kind of a data which is to be, and these data, Varun, not only these data is to be kept with the government department only. These data is to be circulated among the departments like PWDs and the architect's office, and so that the importance of such design of the building is to be sensitized among the government officials. And there is a need of lot of such workshops, I think the initiative which you have taken along with ma'am, and since it is not been only a academic exercise, I think this should percolate to the bottom level of the design, which is like it.
Absolutely.
Yeah,
Absolutely, sir. Absolutely, completely agree with you. And what comes out from your reflections is very, I think you're giving us a lot of confidence to take this forward. Like, when you're talking about this interlinkages between, is there data at the disability level? Is the information going somewhere? I always love to take, or whether schools and colleges and the schools of planning, everyone's aware of. I was always aware of the travel, not always, whenever it started many time back, of the travel tile and the stop tile, such a minor thing. Now since I have been associated with this project, I am so vigilant about it. It's like that polio की दो ड्रॉप, जब तक वो एक एक बंदे के दिमाग में नहीं घुसेगी कि खाली दो ड्रॉप्स करनी है. So the sensitization needs to be done, and it's a two side sword, because people with disability are not able to come into public areas. They're not visible. The audit doesn't happen. Talking from the angle of being a disability expert, when we go from juggi nukkar nukkars, trying to identify people कि यहाँ पर सेंसस में भी यही प्रॉब्लम आती है कि यहाँ पर कोई डिसेबिलिटी पर्सन है जिसको डिसेबिलिटी है, you won't believe the whole community directs you into the wrong direction.
Yeah.
It is such a attitudinal limitation. So I thank you, Ajayji, and for highlighting all these points. And I'm sure that all of us together will take this forward. The little doables. And so,
Yeah.
may I continue,
Yeah,
Parul?
yeah. I think we can continue as and when the
Yeah,
comments come in. So we will initiate the discussion with the
yeah.
participants.
And please, I suppose everyone do keep putting them in the chat box. If something is missed out, then at least we can take, Parul Sharma can take it forward, and we can take it forward at another platform. Thank you so much for all this important insight, Ajay Kaushal. And so I try to move forward. And so please tell me again. I will try and give my the information. The argument why we are doing it is because human diversity is to be cherished. Accessibility is a must for living. Accessible, inclusive, barrier-free environment enables full and equal participation without facing any physical and social barriers, can effectively participate in various affairs of a city. So here, as we move at a further point, the same thing which Ajay Kaushalji has just put in here is the physical barriers or the physical limitations are happening because of limitation of the information percolating to the last person, the institutional barriers, the communication barriers, and above all, which I would like to put in here, is not, and which I think Ajay Kaushal has also put in, has stated, is where is the disability audit? How many of us did think that there is a commissioner of disability in each city? Did we ever think, or did the commissioner of disability find spaces to interact with the urban planners and see that certain things did happen? Were the people with disability in that particular city proactive enough? Activism is one thing, being proactive is another. So, for their rights and etc. So, these are the questions that we put in here, and we're talking about the disability is multi-dimensional experience for the person involved and for the entire family involved and for everyone else. So, when we grow as a society, when we see diversities on our fields, in the open areas, then automatically each individual learns to articulate effectively. So, somewhere I take back this important point that each bus stop, everywhere, if there are doables, एक चौखट से फर्क पड़ता है, something like this. And we were thinking about that earlier also. Accessibility is a precondition to realize inclusive society. So we again don't have to I really don't need to repeat, but it's part of this. The rate of poverty increases, deprivation and exclusion of the person happens. So awareness programs, and that's what this is the beginning for this particular program. And we are always looking forward to having we are planning to have a lot of training programs of different a level hierarchy of people in different parts of different organizations. And of course, we are very aware of these principles of universal design and how tolerance for error. And this is what brings from me as a disability expert, if there is a lift, if there is a knob, the knob has to be put in there, which allows my wrist is not able to work. Can I use my elbow to do something about it? If one finger doesn't work for being able to, press the button in a lift, can I do it with my wrist? So that tolerance of error, and again sensitization, of course, at all levels, as so aptly put by Mr. Kaushik. So we have this the social global roles, goals, and accessibility. Universal design leads to inclusive participation by embedding accessibility in urban areas. To live, accessibility enables a person with disability to live independently and participate fully. Again, it's an attitude, it is the infrastructure, it is the transportation. How many of us who have gone for a trip abroad in developed countries have seen wheelchair users running away? Of course, we have the Indian Spine Injury Hospital in in Delhi, and Dr. Aluwalia, who was a wheelchair user, would be going around the place so effectively, and it was so difficult keeping catch up, I mean trying to keep uh, walking along with him, because he was so efficient in using his wheelchair. Going back to those developed countries, those wheelchair users are also going to see soccer game. Can you imagine a wheelchair user or a person with any disability going and watching cricket match at Firosha grounds? Impossible. Everyone's going to say, "Ye kya?" Can you? This is the attitude. How do we bring about this change? Only, and who is to bring about these changes? These are the other things. Of course, India has tried to have the accessibility for persons with disability, and for that we have the Accessible India campaign. And when we talk about the Accessible India campaign, then we have three parts to it: built up environment, transportation, ITC. And so, again, this is only a retaliation for, I mean, a relook at us, for us to remember, and so that we can go more strong back again. There are so many acts and policies. If a building which has been recently made, we may not have the power. I do understand there's so many other issues, but wherever there's a voice space, can we actually voice that there are so many different acts and policies? In continuation with the question, the there are so many national institutions. The linkage between urban planning, or the dialogues between the urban planners and these institutions who are doing very good work for persons with different disabilities, doesn't seem to happen too often. So I only can leave you with a lot of questions. How do we go about doing it? Are we also aware of the number of different statutory bodies related to persons with disability? And they are also not connecting with the urban planners. The school of planning and other organized local government planners, etc., are also not associating with them. Can something be done about it at a beginning level? Of course, why accessibility matters is these are the reasons: because then public spaces becomes more accessible for everyone. information and communication becomes more. The government of India has made it mandatory that all government websites have to be technology friendly for the persons with disability. And I think they have become also. And the museums, the changes that are happening in the museum, if you can see here, it says please touch. Mostly if you go to any of these spaces, it says please do not touch. So may I just finish this particular slide, and I'll continue on to the other slide. So as of now, I'll stop sharing this. And if there are, before I go on, and let me start the second one slide, and then if there is a very pressing idea or a thought that's bothering you just now, please take this opportunity to please talk about it while I'm trying to put the other slide on. Anyone, please?
Arul, ma'am,
Yes.
again, once again, my side this time. Do we have any curriculum, prescribed curriculum for School of Planning or for the Architecture College on accessibility? Do we have any subject right now, because we are producing so many architects and planners? Do we have any kind of such curriculum? I think right now we may have been touching upon little on the in accessibility subject, but not fully. So I
Absolutely.
think,
Parul
yeah.
Sharma.
Yeah, I agree. Thanks, Kaushalji, for coming in once again. So at present, like when this act came into picture, Rights for Persons with Disabilities Act, so there are provisions. It has specifically mentioned that universities should, focus on bringing in more subjects and more research into the disability sector and universal design practice. So universities are slowly understanding the need of this significant issue, and they are revising their curriculum in many institutes, especially in SPA Bhopal and School of Planning and Architecture Delhi as well. And recently we conducted a workshop like this in GNDU Amritsar. So they are also thinking of bringing in disability component in a town planning subject. And many institutes which are doing research with the government, like NIUA and other allied institutes, so they are coming up with the e-learning programs. So very soon this material which we have developed, so we'll be uploading it with the Ministry of Housing and Urban Affairs on a national urban learning platform, and e-certificates will be issued for officials or professionals who will be undertaking this particular training program which we are presenting to you right now. So later on, all those participants who are attending this, so we'll be sharing the link to that course so that you can go and go through this course and submit a quiz and get a training certificate. But
Parul,
yes,
like
in the norm,
one thing I
uh,
want to add, like we have the energy audits, we have the fire audits. We definitely would like to see in coming years or having the accessibility audits, like
correct,
you mentioned earlier.
correct. Yeah,
I think
accessibility audits. So the
I
need of the hour is, training of trainers. First thing
yes,
is like how many auditors we have, and
yes.
once they are trained, how can they go into field and train further
It
various.
could be in the beginning, it could be a responsibility of institutions. I think you have to develop the institutions. That's what I am
Mhm.
specifying in the beginning of my talk, is that do we have any curriculum in the School of Architectures or in School of Plannings? So if
At
we have
present,
trained, because it is easy
uh,
to train those professors and faculties, those who are being really sensitized on the subject. And if we build that institution, I think the trainers will come automatically.
I
Absolutely.
agree. I
Absolutely,
agree.
completely agree with this. And this is what's happened in the field of medicine, field of disability, field of education,
Mm.
teacher training. That
But
programs like this sensitized. Now, when you raise this question, there will be so many others. And as we move from city to city, from, yeah, from school of planning across the country, the next curricular movement will happen, and it needs to happen very fast. Regarding the
Yeah,
disability audit, we already have in place, and there are organizations not at the government level but at the level of, I'm forgetting the name, Parul, do you remember? Yeah, I mean, who's this person? There's a NGO which is doing very effective disability audit, but it's happening at the level of
like
NGOs. Hmm.
many NGOs are coming in, like Swayam and
Absolutely.
other such NGOs, Samarthyam. So
Hmm.
these are few NGOs. Then Cape Foundation. So I'll tell you, Government of India recently has done audits of around 1639 buildings under the Accessible India campaign, which ma'am will be explaining very soon. And under that, and also I'd like to cite the example of Central Zoo Authority, which approached me like last year. Their DG asked me to conduct accessibility audit of all the zoos in the country. So she told me that if you can train my engineers, so they will be able to do audits within their building. That's what you are saying, Ajay ji,
Yeah,
building the institutional capacity. So as of
yeah.
now, there is no curriculum in various universities, but yes, initiatives are happening like learning modules I have produced. So this is a knowledge product which, if I hand over to a institution free of cost, so it can be used as a knowledge product for further training of officials within the institution.
Parul,
And we
one thing, I just sorry to interrupt you in between, because sometimes your question of your mind just goes like that. So one thing
no, no, please go ahead.
I could mention here is that if the central government or with the help of the state governments, if they incentivize the buildings, like you said, because it has to have come from first from the government buildings itself, the public sector buildings,
Hmm,
right? They can incentivize,
correct.
the central government or state government can incentivize the buildings which which follow these harmonized guidelines fully, in shape of
Hmm.
any kind of a subsidy or any kind of a financial help for or in case of kind of a capacity building program or something like that. I mean, just to motivate the people to get into the stream.
I agree. I agree. But to be honest, because I was working with the Ministry of Social Justice, Government of India, and managing the Accessible India campaign earlier. So government says now it is the mandate. Why should we give incentive? This is the mandate. This is the law of land. The Rights of
Yes,
Persons with Disability
exactly,
Act
exactly.
under the accessibility section clearly says that no project, no building sanction can be given unless or until they adhere to the harmonized guidelines. So they say this is the law of land for which no incentive needs to be given. So
Yeah.
that's the stand
Okay.
of the central government.
But the only
And
thing is that
uh,
it is very difficult.
yeah,
It is a part. The crux is that you have to motivate the people, right?
Yes,
yeah,
yes,
and to be honest, correct. And people will get motivated once they understand that this is not the story of disabled community, but story of my grandparents, my parents who go out in market, my children, my
Yes,
wives. You know,
yes,
so this is something which is touching upon every family. It's not about a particular section of society. And suppose an accident happens to me, I am on wheelchair. If
yeah,
I going back home and I fell down the stairs, I'm a person on wheelchair. That's what happened to, I would like to quote SPA director Mr. Chetan Vaidya. So
yeah,
earlier he was not that much interested in the subject, but when he met the accident, he called me that Mr. Sharma, you are right. We as planners, city designers, we have created so much barriers in our cities,
mm,
and he was so passionate about bringing in change in the college premise and and sensitizing various urban practitioners. So that's
yeah,
how change comes in through lived experiences. And uh, I think most of the mistakes are happening in ignorance because,
yes.
uh, as we rightly mentioned, that we see very less people with disabilities on wheelchair in the city we move around. So we often forget the challenges they face, and such problems happen in city designing and while making provisioning for the infrastructure.
See, we have done
So yeah,
lot of reservations for the physical handicapped or disability people into the government sector and in the private sector. But how many public
Mm-hmm.
buildings and the corporate buildings does obey these harmonized guidelines and for the working environment, good working environment for the people of with the disabilities? And that is
Yeah, you
where
are
we need to motivate the people from inside by incentivizing certain things. Because see, if you incentivize the
right. I agree.
corporate sector, I think they will definitely do a lot about it. Because but because government sector, if I say the government is planning so many things, I think you as a planner can plan wonders. But at the regulatory level, there is a regulatory failure basically.
Yeah,
There is no
there are.
integration between the regulation and the planning.
Absolutely.
I'll tell you why this is happening. It's a big topic, and we have just made started to
Yeah,
initiate
yeah,
the
yeah,
dialogue.
yeah. Okay.
In like regulation, who will done the state disability commissioner? They are themselves
Yes.
struggling with the staff personnel. Like in some states in Northeast, I know one or two people in the
Today
state.
only I get to know about that somebody is like a disability commissioner.
Yeah,
So,
so there is
so
a need
our
for
job has
strengthening.
been done. So I think we have done a good job today. So we know that we were here to create awareness. So one awareness
Yeah,
created. So now
so
in Patiala,
let
the commissioner of disability there, Parul, is going to suddenly realize, इतने सारे लोग क्यों आ रहे हैं मेरे पास
again,
आज?
he can
So
be
then
our
they're going to catch hold of you,
he will
Parul.
act as an ambassador to RPWD Act. So he will take the flag and he will be our ambassador to take up the cause of. But this is something I think this is touching everybody's lives, and not only about urban planners or persons who are having some form of disability, but every normal citizen in the country, because at some point of life we experience this.
Yeah,
Suppose we are having s- some accident or some fracture. So, and making spaces accessible helps everyone. So I think we can continue with session three. We can move fast so that in the end we can have some questions, and we would
Absolutely.
like to hear from other participants as well if they have
Absolutely.
some
Absolutely.
experiences to share. But
And
again, thanks to all of you for giving, sitting very sincerely and listening to us, especially on a working day. Over to you, Renu ma'am. Maybe you can continue.
Ah,
So
thank you so
thank
much.
you.
Thank you. I love the dialogues that are happening. And this is what the initiation of change is. So I'm hoping that wherever I go in Patiala, the next time when I go there, all the ramps will be 1 by 12 minimum. Right? So anyway, let's see what happens. And the commissioner of disability there is when he comes to Delhi to RCI would keep asking this question, ये हुआ क्या है पटियाला में सब लोग मेरे पास क्यों आ रहे हैं? And here we go is understanding discrimination. ये मैं व्हील चेयर पे हूं तो मेरा कोई और चीज नहीं देख रहा, खाली ये देख रहे हैं कि तो फर्क है. We had this professor at NCRT who was blind, and the next professor in the next room cabin would always find this so amusing. जो भी उनके पास जाता था तो वो जोर जोर से बोलता था. And this professor very love I mean a mentor for me, and learned so much from him. And he would say बार बार से मैं अंधा हूं, मैं बहरा नहीं हूं. So this is what discrimination leads to. क्या हम भी कहीं ऐसे कर रहे हैं? And again, giving an example, this person with who was blind, who needed braille to be written at places, right, and at arm length, one is trying. I mean, you have the signages or the nameplates are way up there. They need to be at arm length. So the person who is using braille or is visually impaired, not completely blind even then, can go through and onto the wall putting the hand and can read what is written there. And this is the type of thing, little changes that we need to bring about. So that, like he would say, Mr. Mittal, Dr. Mittal, Professor Mittal, he would say कि उनको घर नहीं मिल रहा था. घर मिलना था, क्यों नहीं मिल रहा था उनको? क्योंकि वो सेकंड फ्लोर पे था. तो जब वो वहाँ गए तो सब खड़े हो गए और बोलने लगे, सर आपके लिए इसलिए नहीं कि ग्राउंड फ्लोर का घर नहीं है. अगेन ही सेड द सेम थिंग. मैं andha hu. We are not allowed to say the word andha. We call it blindness or visual impairment. And he would say, मैं हूं तो हूं, right? मेरे पैर में कोई प्रॉब्लम नहीं है. So sometimes we just don't know what to discriminate, right? So coming here, um, I'm getting feelers from Parul to go faster. And here comes in the causes of discrimination that we have already spoken about, and understanding discrimination is assessing physical environment, transport, assessing health, rehabilitation support and accessible services, assessing education and employment opportunities. So this is why what discrimination happens. We have a lot of work being happening for smart cities, but accessibility and inclusion is not smart city only. It's a component of smart city, inclusive society for smart people, and understanding inclusive urban policies. So for understanding inclusive urban policies and programs, it the inclusive urban processes are both a means and a goal for the implementation of the convention for the rights of persons with disability and 2030 agenda for sustainable development. So we need to work on removing fundamental barriers which are excluding, and that's what the interactions were happening just now, such lively, so important reflections that were happening. They're promoting independence, participation in society, ensuring full participation of persons with disability in the mainstream. And the person with disability is not only the person with 15% disability, it's so many, as Parul Sharma said, a gamut of other people. Now, when we're talking about understanding inclusive urban society policies and programs, UNCRPDV India is a signatory. So we need to focus on that. And again, said the person with disability is not only the 15%, it could be age related, gender related, or disability status related. Realizing accessible inclusion, we need to have again the same mandates that we were talking about, we have already discussed. Because of short of time, I'm moving faster. And inclusive participation is by embedding accessibility in urban areas. It needs to be embedded into our entire system. And the questions that are raised, where do we start off? We start off from where? In service, training, and pre service awareness, sensitization, creation, taking along the public to understand. An inclusive city is a place where everyone can access everything and feels empowered to do so. Well planned cities means people with disability, their families, and communities are happier socially and are better off financially. The attitude changes. There have been researches done where once taken, especially on purpose, people with disability have been taken to large malls. Passerbys have said, इनको यहाँ लाने की क्या जरूरत है आपको? Now, because they don't understand, this is what we need. We need these people to come out. Only then will we get to know what are the issues that they face. Like Padul Sharma said, that Chetan Vadya, when he had a temporary disability, then only the changes came in the school of planning. And of course, you have Parul Sharma standing here looking what can he possibly do about this. And others, this is what happens. Two stairs, two steps for somebody, but a matter of yes or no for somebody else. Accessible India campaign, and the major components is built environment, transportation system, and information and communication technology. Does Patiala have spaces in different marketplaces and elsewhere which are Wi Fi enabled? And any person can sit in the veranda and use that, what is it called? 5G advantages by sitting there. Delhi does have that. There are so many different policies, and as discussed earlier, the policies, our Indian policies, are well made, but we need to look at the consequences. This urban and regional development plan formulation and implementation guideline of 2014, it does not, the guidelines are not mandatory and only suggestive. And as discussed, so many things are mandatory, even then they're not happening. So if they're suggestive, this definitely the action taken would be very limited. National urban transport policy again not mandatory but suggestive. So as we move into different uh, top level committees, etc. It is you and I who will be, now that we are sensitized, will try and bring about these changes. The policy, the National Transit Oriented Development Policy, the policy needs to be promoted so that its outreach increases. So, therefore, we have a slide right here, and we have the other, we also have the National Disaster Management Plan, which, at least when we're talking about what Mr. Kaushik is saying, that in schools and elsewhere, the sensitization has started. Of course, it takes 20 years, unfortunately, to be an overnight success. We also have Jawaharlal Nehru National Urban Renewal Mission and the PPP model for affordable housing. And when we're talking about affordable housing, can we have a housing for the persons with disability too? And if it is 4% quota, is there a quota in housing for persons with disability? Is it being implemented? Are there people to take it? And there's the number of sections in UNCRPT. These slides will be shared with you, so you're most welcome to go through them at leisure at a later point. We in Delhi have our own Delhi Development Authority Act. Similarly, Maharashtra also has its own. Is Patiala working towards it? The future of accessibility, digital inclusion in smart cities. COVID has taught us how to work more efficiently through technology. And here comes the importance of having digital inclusion in our cities, starting with micro hubs and expanding that. And when we are getting that digital inclusion or accessibility in those hubs in our city, shall we also be looking at sensitize ourselves? What does a blind need? What does a hearing impaired need? And what does a physically challenged person need to be able, for example, when you're talking about the zebra crossing? And if we have those little raised yellow space, automatically a person on a wheelchair will be able to cross the zebra crossing with lesser fear, and will be able to do it without needing the help of somebody else. The cars will have no option to stop but to do it. Or you have the application of laws, implementation of road laws as effectively as it is done in Chandigarh. Smart city technology, makes a city more manageable and more personal because you have the sensing happening. It's so difficult in my city now to jump a red light because you get caught not immediately but after two red lights, the police person catches you. Thanks to digital technology. The solutions are at pocket size solutions. The tech team that is working here, most of these youngsters, they're working on their mobile. I seem to be the only one using a laptop. Seamlessly integrates their daily life. And of course, we are seeing it all, the how seamlessly everything is becoming so very possible here. Alerting emergency services, Civic, what I was trying to highlight was the same thing that's spoken here. Civic kiosks that incorporate universal design of architecture and cloud-based accessible features, developing new solutions to benefit everyone. So the aging, the person with disability, the the non-gender biased person, who a pregnant woman, anyone, youngsters, even having, they're even thinking of having ways in which, when you're taking your young infant or a toddler into the market spaces, how do you keep an access on him or her? Innovations proliferate the smart city technology. Local government should be committed. We have an example here, which we were part of, was Mount Abu. The local government sensitization and the desire to bring about change has brought about many changes there. And what is being highlighted here and being reflected upon, disability sensitivity, removing structural barriers. And so we come to the policy frameworks. Policies are again and again, as said, we have good policies. India is known for its good policies. But the implementation, where we are able to work in together in a multi inter institutional get together, doesn't seem to be happening. So we have this whole Ministry of Social Justice and Empowerment, and we also have the National Information Center and the Bureau of Indian Standards, Ministry of Consumer Affairs, Ministry of Communication. But there are changes. We have the persons with blindness, who for whom the work done at the Ministry of Communication has been very effective, although they tend to utilize take more advantage from the Ministry of Social Justice and Empowerment. So there can be more done in that area. And when you're talking, we have the EPICS policy, and which is the Rights of Persons with Disability Act 2016. And this was which was with the ownership of this goes to the Ministry of Social Justice and Empowerment. And we have the sectorial policies, which is the guideline for Indian government websites, which comes from the National Information Center and the others here, and the accessible standard for persons with disability in television programs, which comes from information and broadcasting. And so this is, wherever these different ministries have been able to work together or forced to work as a unit, keeping their identities but working together as a unit, it has been effective. But we, the people from different areas of specialization, need to also be able to force them, help them to work into these areas here. Future areas for development is, we are providing increased support to policy coordination and uh, uh, providing increased support to policy coordination, implementation, and monitoring is a priority. In 2018, Telecom Regulatory Authority of India had been working on all these, including the representations. We had a wonderful committees were developed, which were cross-functional committees, but they still need to. Not much went forward as of now. I'm sure something will happen at a later stage. Standard for accessible device and embedded assistive technology are a missing link. And a handset certification, embedded accessible standards, uh, all this is still not in place. And we need to create awareness of policy and existence of assistive technology in holding back progress of digital inclusion of persons with disability. The awareness and sensitization, doing the doables, not taking in such large chunks into our mouth that we are not able to chew. And when technology, city infrastructure, and planning, it will require the city uh, monitoring city infrastructure, sensors, CCTV, AI utilization, mobility strategy, city planning, waste management and sensitization for air and water quality. We already know this, and traffic flow, which technology is helping in a big way in many cities, and connected real time devices are detecting traffic obstacles, and we have the GP systems, etc., now in place. For those of you who would like to go forward, there are all these resources, and some of them are being already put into the chat box. Last, the second is monitoring and evaluation. Measure performance, mitigation risk, and achieve success. And here we talk about defining data. And we've already had a discussion coming up about the issue of data. Do we have the relevant data? And if that data is there, is it on the public platforms? Second, as an individual, am I aware of where to access it? Although Google has made it so much more easier for us to be able to identify where do I go and try and get that data. But there are limitations in our sensors, there are limitations, and of course, this is how a country develops, going from developing to become a developed one. And that's what we are all attempting to do. So, data science seeks to understand and address problems. Data science methods apply to digital data too. Big data refers to data sets that are too large for traditional analytical methods. So, now there is this whole thing about mining data. There's so much of data, how to access the relevant data. So we there are certificates being done, there are diplomas that people need to do. So all of us also need to understand and at least have some sort of orientation to how to mine data. Significance evidence, of course, we know that national data collection systems are in place, and significant barriers. If I wish to, like the discussions that have happened just now, that if I want to making those ramps, it is expensive, पर कोई आता तो है नहीं. I have so often heard this, that it is mandatory in all institutions to have a wheelchair at the main gate. And majority of the institutions that I go to, the wheelchair is kept somewhere inside. जब कोई व्हीलचेयर यूजर आएगा तो वो फोन करेगा तो हम भिजवा देंगे. This is because it's so not natural. It reminds me there was a time as teachers and professors, the chalk used to be kept under lock and key. But as we move forward, I'm sure we can leave our wheelchair at the gates also. Is there something that is being done in my institution? What am I able to do about it? Disability inclusive data, lack of data and information on disability, as the question raised by the participant. And the experience of people, the lived in experience of people. Parul Sharma has tried to bring in people with lived in experiences in some of our earlier awareness creation training programs like this. And it has had a very good impact on the others to understand, अच्छा ये भी होता है. And the resources are here. Coming to the last part, towards the localization of SDGs. the Sustainable Development Goals, recommendations to ensure equity and accessibility, not equality, equity. But that equity, if it is a smooth road without any breaks in between, then automatically it is good to me, it is good to the wheelchair user, it is good for somebody else. If the uh, noise levels are controlled, then the person who is disabled is able to drive effectively. There's no problem. There are very good, effective drivers who have hearing issues. But again, if there are these extraneous noises, it becomes extremely difficult for them. So, are we using? I know of so many auditoriums where the acoustics is not effective, and the amount of money that has gone to make those auditoriums. The Sustainable Development Goals are based on experiences, they are multidimensional approach, they leave no one behind. And they're global in nature. They're not different from country to country. They're universal, integrated, inclusive, and they, above all, the point that has been praised again and again here is they need to be measurable. Are those facilities being utilized? If not, where are those 15 plus the senior plus the others who are not being visible in public spaces? And from here, we come to the last part, and we're running short of time, so I'll go try to go faster. Local government is at the core of SDG localization. The local government should be aware of during emergency response, leadership, service delivery, and relief resources. And as said earlier, catch them young. मेरे को तो लगता है कि जो हमारे एमएलएस वगैरह भी है उनका भी कोई छोटा ई सर्टिफिकेशन होना चाहिए था. Rehabilitation Council of India, which is called RCI, had attempted to make that even half day program. So wherever they go for any particular gathering, committee, or any activity, there is a PowerPoint presentation which is done quickly for their consumptions. So the local SDG localization strategies, the key takeaways are established plans to localize the 2030 agenda for sustainable development, ensure that sub-national priorities are reflected in the national strategies, provide financial support and capacity building. And this is a 360 hen issue. I showcase my micro activities, then I get financial support. If I get financial support, I am able to showcase the accessible, inclusive activities in my city. Capacity building, also the same thing. Capacity building cannot only be at a particular part of the ladder, the senior people or the junior most or anyone. It has to be at every level, and it has to be cross institutions. Giving priority to budget allocation, meet with local leaders to prepare opportunities. In this little endeavor of ours, we have been trying to do that. And the resources here are here. And I'm leaving the last 10-15 minutes for discussions and everyone's thing here. Thank you so much as we move from MDGs to Sustainable Development Goals. And these are some of the material that is present online on Google. Please do go through them. That says the harmonized guidelines and standard for universal accessibility in India, a very good document. And what Parul Sharma has been saying and has been working in this area is Accessible India campaign. And we also have the Persons with Disability Conference Conventions, and of course the RPWD Act 2016. So, with this, I love this particular, you know, does it really require a lot of finance? Or when I'm working as a planner, this is a very simple installation which can be done. And I'm sure this is, I know that this is not extremely expensive. Now, these are stairs, and each stair just moves up, and you walk through this moves further, and then you're able to reach there. So, not maybe in a very public building as of now, but as we get accustomed to these in different buildings, then automatically its movement into at the railway stations and so on will also happen at some point of time. So, thank you so much for listening to me, and over to Parul Sharma.
Thank you, Professor Renu. And really, I feel so overwhelmed, and especially my earnest thanks are due to various officials of Patiala city for being very sincerely listening to us. And I really want to hear their feedback. Uh, Maybe we can start with Seemaji. What do you think? What's your experience while working in PDA DTP from Patiala city? You can share what you find on ground. Are we progressing in when it comes to universal design? What are your experiences?
Yeah, well, what I will say that here, as the discussion part which is coming out, first of all, we need to calculate this whole idea to schools, universities, and all, right? But it will take definitely it will take time, 20 years, 25 years. So we as planners or architects, we need to start this idea from practice itself. Because that's why I have asked Patiala Architects Association to join, because these are the architects who can right now educate the society to incorporate these kind of things in our buildings, because these architects and planners who are basically designing for the government buildings also and private building also. So this is the need of the art to incorporate, and later on it will be added in the educational system, of course. But right now we practitioners need to engage ourselves and come voluntarily for this thing, I think. Mr. Walia is here, I think. Mr. Walia, can you hear me? Walia ji, Architect Walia, Architect Rajneesh.
हेलो.
हेलो.
यस मैम.
हाँ जी, रजनीश जी, आप सुन सकते हैं मुझे?
हाँ जी, हाँ जी, आई एम लिसनिंग टू.
या आप अपने सजेशंस दीजिए सर, प्लीज.
See, there are a lot of things which has to be done practically.
यस.
But what we are having, that is just the manuals, just the write up in the building bylaws and all the things. But there are very
आलिया जी, आप क्या वीडियो खोल दीजिए, टेक टीम कह रही है.
my
आप
webcam is not working.
ओके ओके ओके.
So the issue is with the our concerned departments and the private practitioners and the owners who are not implementing fully to all this cause. So we have to be look after all these things very practically, not with the approvals, but with the solutions and the practical implementations at the site. With the so after the approvals, there must be a site visit after a certain time, like after 1 year or 2 year, to see whether all these things have been implemented at the site or not. Only there's
Yes,
the some,
exactly. Yeah, you're right.
Yeah, I fully agree. Like periodic review and implementation on ground, and then further evaluation.
and
So
I
this
must
is
say
very
there must be some reward on this, or some points to be
yeah,
this, so that the owners or the like private practitioners all should be encouraged on this, that they should be motivated to adopt this and compile with all the bylaws and all the disabilities and the special provisions has to be made. So there should be some encouragement points to be given, that I must say it should have some booster add to it.
Yeah, yeah. I think
mm,
as this we will be the pioneers here in Patiala to incorporate these kind of ideas, and we should educate our clients also, so that this is the need of the hour. We need to do it for these kind of special people. And this, as Parul has already explained, that this is not a story of one family, right? It may be a story of all of the families of the society. So we need to incorporate those things into our buildings also, so that these buildings should also speak out of the thing, right? So basically, we were or we will be the pioneers for introducing these kind of, I mean, बिकॉज कोई भी नई चीज शुरू करने से पहले थोड़ी सी स्ट्रगल्स आती है, तो आपको भी अपने क्लाइंट्स के साथ उतना बैठ के उन्हें समझाना पड़ेगा कि नहीं, ये जरूरत है, एंड वी नीड टू गिव इट। चाहे स्पेस थोड़ा उसमें ज्यादा जाता है या थोड़ा सा कंस्ट्रक्शन कॉस्ट ज्यादा आता है, आई डू अग्री, बट हमें उन्हें एजुकेट करना पड़ेगा। पारुल, राइट?
या आई फुल्ली एग्री। बिल्कुल ठीक कहा मैम आपने। और जहाँ कंस्ट्रक्शन कॉस्ट की बात है, वो मैं बता दूं कि अगर स्टार्टिंग में ही हम ये प्रोविजन कंसीडर कर लेते हैं, तो वर्ल्ड बैंक के एस्टिमेट है और यूएन के कि 1 से 2% कॉस्ट बढ़ता है। लेकिन जब आप बाद में रेट्रोफिट करते हो तो करीब 30 से 35% कॉस्ट बढ़ता है।
This
और
is what we need to educate our clients.
या
That's why I
और
added my fellow architects in the group, because these are
करेक्ट
the people who are designing for the public buildings, private
करेक्ट।
buildings,
और हम अपने
right?
क्लाइंट्स को ये भी बता सकते हैं कि अगर हम अभी एडर कर लें, 1-2% कॉस्ट बढ़ जाए तो कोई बात नहीं, लेकिन भविष्य में मान लीजिए कोई सीनियर सिटीजन है, उसने कोई लॉ सूट फाइल कर दिया, तो उसके रिपरकशन
Yes,
ज्यादा, क्योंकि गवर्नमेंट तो फाइन भी लगाएगा और तब आपको रेट्रोफिट करने में 30 से 35% कॉस्ट भी। दिल्ली में हुआ है कई जगह, कई रेस्टोरेंट्स हैं, जैसे हल्दीराम का आउटलेट है, तो किसी ने
नहीं,
बिल्कुल।
स्टेट सिक्योरिटी
see,
कमिश्नर
for this
में एक एप्लीकेशन।
I have a one very
प्लीज
recent encounter with the departments.
सर बाय।
See, I have going for the approval of a oxygen plant within Rajpura, and that oxygen plant has a certain limitations, that it won't rather employ any special person or senior citizen, or like some any other person will have some abnormalities. They won't employ those persons in their plant, because that is high risk nature plants. So while going for the approvals and while going for the all the necessary provisions of disabilities and the special uh, persons conditions, see, department has very hesitant to put all these things. But the owner, the German consultant who is into the oxygen plant manufacturing, he was denying, you see, we are not looking into this thing, because there is not even a single provision in our like DPR, or not even an employee list or in any part, that we even allow enter to any person who has a special disability, because this plant is a very severe risk of nature. So why you're forcing us to put all these things into the our building plan? So there are some issues for this also, like
आई
I
एग्री।
feel.
तभी ना सर, मैंने अभी आप चैट में देखेंगे जो एक्ट है भारत सरकार का, राइट फॉर पर्सन विद डिसेबिलिटीज एक्ट, तो उसका सेक्शन 44 क्या कहता है, मैंने 2 चीजें लिखी कि किसी भी एस्टेब्लिशमेंट को कंप्लीशन सर्टिफिकेट ग्रांट ना करें। ये यूएलबीज और डेवलपमेंट अथॉरिटी सभी को डायरेक्टिव है। तो ये तो लॉ ऑफ लैंड है भारत सरकार का आज की डेट पे। और जो पहले की बनी बिल्डिंग्स हैं उनको भी डेडलाइन दी गई थी 2022 तक, जब ये एक्ट आया था कि भाई 5 साल आपको दे रहे हैं, इसको आपने रेट्रोफिट करना है। तो उसमें हो सकता है एक्सटेंशन के लिए रिक्वेस्ट डालेंगे कई गवर्नमेंट इंस्टीट्यूशन। बट ये तो आज की डेट में लॉ ऑफ लैंड है, जो हम अपने क्लाइंट को बता सकते हैं कि सर चूंकि आप मेरे पास डिजाइन बनवाने आए तो मैं आपको ये एक स्टेप आगे बता रहा हूँ कि भविष्य में दिक्कत ना आए तो ये प्रोविजन भी कर लें। और जो प्राइवेट एस्टेब्लिशमेंट है, मान लीजिए पब्लिक स्पेसेस नहीं है, भाई घर में कल को किसी के फ्रैक्चर हो गया या वुमेन प्रेग्नेंट है या छोटे बच्चे हैं तो प्रैम है उसका ले जाना, तो ये चीजें तो फैमिली को लाइफ लॉन्ग ही हेल्प करती हैं, छोटे बच्चे से लेके बुजुर्ग तक। प्रैम उठा के तो ले जाएंगे नहीं, तो रैंप होगा तो ये चीजें हम धीरे धीरे शुरू होगा, हमारी कंट्री में काफी स्तर पे हो भी रहा है, बट इट विल गिव बेनिफिट्स इन दी लॉन्ग रन। तो जो आज हम डायलॉग इनिशिएट कर रहे हैं, मुझे लगता है दिस लॉन्ग टर्म दिस विल हैव वेरी रिवार्डिंग एक्सपीरियंसेस। और भारत सरकार का इंसेंटिव की मैं बात बताऊं, आज की डेट में तो नेशनल अवार्ड्स हैं इनके, जो इंसेंटिव के रूप में मान लें, तो अच्छी प्रैक्टिसेस को अगर सिटी गवर्नमेंट करती है तो उन्हें दिल्ली बुला के राष्ट्रपति से अवार्ड भी दिया जाता है। तो काफी सिटी गवर्नमेंट्स को मैं देख चुका हूँ जो ले चुके हैं भारत के राष्ट्रपति से अवार्ड, यही छोटे छोटे चेंजेस करके, एसेसिबल सर्विसेज प्रोवाइड करके अपनी सिटीज में और प्रोजेक्ट्स में। तो ये प्रोविजन है। और स्टेट डिसेबिलिटी कमिश्नर के भी अवार्ड्स होते हैं। तो अभी जैसे 3 दिसंबर को आएगा इंटरनेशनल डे ऑफ पर्सन्स विद डिसेबिलिटीज, तो उससे महीना पहले सभी अवार्ड निकलते हैं। तो ये इंसेंटिव है आज की डेट में। और सभी सरकारी विभागों में मुझे जैसी जानकारी है, एक ओएई करके एक्सपेंडिचर होता है जो जनरल एक्सपेंडिचर में हम यूज करते हैं, तो उसमें करीब 3% भारत सरकार के द्वारा रिजर्व होता है कि आप अपने ऑफिस को एसेसिबल बनाने के लिए, रैंप लगाने के लिए, लिफ्ट लगाने के लिए, टैक्टाइल फ्लोरिंग लगाने के लिए यूज कर सकते हैं वो बजट 3% के करीब ओएई एक्सपेंडिचर के अंडर। तो ये आप अपने विभाग में अकाउंट्स से और जानकारी भी इससे कह सकते हैं कि प्राप्त करें। तो मैं चाहूंगा कोई और अपने हमारे बीच इतने एक्सपीरियंस प्रोफेशनल है पटियाला से, सुरिंदर सिंह जी हैं और भी सीनियर ऑफिशियल्स हैं, कोई अगर शेयर करना चाहे ग्राउंड एक्सपीरियंस कि क्या उन्होंने फेस किया पटियाला में, या कोई और एक्सपीरियंस हो उस टॉपिक से संबंधित, फिर उसके बाद हम एक कार्यशाला को फिनिश करेंगे। लेट्स हैव सम मोर सजेशंस एंड व्यू पॉइंट्स। ओवर टू यू सीमा जी, अगर आप किसी को पर्सनली आइडेंटिफाई करके वॉलंटियर करना चाहें।
What is Alia ji? I think it's not here.
Parul,
Yes.
can you do you have the copies of these acts
Yeah,
on the
definitely.
website, government website, or you can share the link of that in the group?
I have shared the link earlier in the chat, and for RPWD Act, I am sharing here, and I have shared all the PowerPoints with Seema ji. It has a resources PowerPoint slide, so there you will find all the links.
Yeah,
But,
that will be fine.
okay, I have just received this email. We'll share the PowerPoints on this email ID as well. I'm just copying this email. So, yeah, and so I was saying, and a very useful document is the harmonized guidelines, which I was just talking about. So, if you refer these harmonized guidelines, it lists down all the provisions very clearly. And good thing is that the Act mentions the name of harmonized guidelines. Like for accessibility provision, one can refer to the harmonized guidelines to take care of, all these statutes and architectural and planning provisions for creating a barrier-free environment. So I've just pasted the link once again here. These are the harmonized guidelines. Okay, so anyone would like to volunteer to share their experiences before we come to the last part of this particular session?
I
And
think
before making,
we have done Parul
yeah,
now.
let's have
If
a group
anybody else
photograph.
want to volunteer, he is most welcome.
We can do one more thing. like before, as a remembrance. So let's have a group photograph. Whosoever wants can open their webcam, they can, and let's have a group photograph before we leave. Then we can sign off. So
You have to take
if
the
someone is,
screenshot, Varun.
yeah, we will take the screenshot as a remembrance.
Yeah.
Okay. Okay, ma'am. Renu ma'am, Seema ji, would you like to say a few words before we all sign off and come? We have came to the concluding part of the workshop.
Uh,
My
I,
earnest thanks are really due to Seema ji for considering my request and introducing me to her colleagues, and she has been very vital and a big force in making this realize. And I'm so overwhelmed that we at least initiated the dialogue in Patiala city.
Yeah,
Yeah,
it
it
was a
was a
nice
nice experience,
fun.
and I will uh, expect
Expect
that
that
we
we
will
will
be
be
having
having
more
more
such
such
sessions
sessions
in
in
future.
future.
Yeah, sure. And I think this has become my passion. So not only because we developed few modules for Australian High Commission, but I think as a usual practice as well, I want to this way I want to reach out to every city, if not every city, but most of Indian cities, so that I can talk to various professionals, take their viewpoints, and I feel as a planner, talking to people, I am learning more than what I read in books. So our peer professionals, the viewpoints and the kind of problems they face on ground is a very big learning opportunity for me. Over to you, Professor Renu Malviya. How you felt with
I
interacting
love
with the
this. I
professionals
love
from
this session more than many others, and because there were such important questions that came in, and what is emerging here is, as planners, would you like to take this channel, have some campaign or have some sort of competition at school level, at planning level or something, and have those small slogans like the polio ones that we had, and maybe something that would lead to more sensitization across the city. That's what I feel. Thank you so much for giving me this opportunity, and I'm so grateful to all of you for listening to me. Thank you.
Thank you, ma'am, for the
Thank
wonderful
you.
session.
Thank you,
And
ma'am.
Varun, thank you, ma'am. You have a wonderful session, and I think most of the our participants are overwhelmed with the knowledge that you have shared on such platform, and will definitely will try to carry it forward.
Thank you so much. Thank you so much for giving me so much of appreciation. Thank you.
Yeah.
Oh, sorry, I was on mute. Okay, thanks a lot. I think we can then move ahead and you all can sign off. Thank you.
Okay, Parul. Bye.
I wish I see all urban practitioners very soon in Patiala,
Thank you.
and we make it as a model inclusive city. And
Yeah.
who knows in future, like you professionals might be getting awards from the President of India. So
Oh.
that is I foresee it like after 2 3 in next 1 or 2 years, because this is the main agenda why those awards have been established, that if a city is doing good practices and they showcase to the government, so Ministry of Social Justice calls them to Vigyan Bhavan and felicitate. So I see this as a next step.
Thank you.
Okay,
Thank you,
thank you,
Parul.
ma'am.
Okay.
Thank you,
Take care.
Seema ji. Thank you, everyone. Thank you, Ajay ji. Bye.
Bye. Bye. Bye.
Bye. Bye, Pavel.
Bye, bye, ma'am.